Three, two, one. Welcome back to AT Talks. We're still on topic one, introductions and how you became the athletic trainer you are today. Ed, and we have Nick. I'm not going to attempt to say Ed's last name. Wozniakewicz.
Close. It's Wozniakewicz.
Wozniakewicz. But the floor is yours, brother. Feel free to say whatever you like.
Right. So yeah, I'm Ed. I actually live and work up in Vermont. How did I get into athletic training? Well, luckily in high school I had an athletic trainer. Not many high schools in my area had an athletic trainer, but I was lucky enough I had two. Didn't really know what it was. Spent some time in there, but just started asking them questions, grilling them all the time. My senior year, I had no winter sport because I liked hockey, but I wasn't good at it. Played basketball, but was not good at that either. So I needed a plan, a third plan. So I went to them, made up an independent study, and they took me under their wing, and I got to see some pretty cool stuff. My friend was actually a hockey goalie. I actually saw his knee sliced up from a skate. So that was the first time I saw blood and fat tissue and didn't get nauseous. I was like, I think I like this. So I did my undergrad. I went to Endicott College. Went there for all 4 years. My senior year, I did my internship with UMass Lowell with their women's soccer team. They were Division II at the time. When that season was over, I still had a couple months left, so I went to the head AT, Artie Poitras, who worked with their men's hockey team, and he really just kind of simplified athletic training because up to that point it was really kind of complicated. He asked me if I had any plans after undergrad. I was like, I have no idea. Started looking at jobs. Everything said master's preferred. So I just thought, hey, I'm not going to get a job if I don't have a master's. So luckily enough, I applied to one school, which probably wasn't the smartest plan. But anyways, I went to Springfield College for grad school, finished my master's degree there. And then I moved up to Vermont. Castleton was the first job that offered me a job. And I've been up there for the past 8 years. I've been working D3 college football by myself, rosters anywhere from 85 to 130. I like the 85-man roster better, a little more manageable. Women's basketball in the winter, and then men's lacrosse, repping them right now in the spring. So that's how I got to where I was. I know a lot of people have been talking because I've been watching the videos about kind of what their philosophies are, and I'm actually kind of in the process of changing how I want to practice athletic training. I've always been kind of a textbook guy. Modalities was hammered hard in undergrad, so I've always been kind of a modality guy. But I feel like the more I've been in this, the less I know, and the more I want to figure out. And I want to figure out more treating problems than just throwing a Band-Aid on it with throwing like a stim or an ultrasound. I want to actually do things. So I'm starting to get more into the rehab and wanting to utilize that more. But it's hard to figure out right now. The athletes, they're pretty good for the most part, but a lot of them have to get out of that mindset. So I'm trying to change their thinking into how to get better and not just feel better. Yeah. If you get that. So yeah, that's me in a nutshell, really. So
well, thanks for sharing your story, Ed. The culture here is just last 20 years. It's ice. Everybody time is
Oh, I know. I mean, that's why I posed the question on Twitter a few days ago, and I mean, I liked a lot of the feedback, but still, people are still going ice on it, which I get. I mean, yeah. I can't see myself going completely away, but yeah, that's for another time.
I think it's fine here and there, but thanks for sharing, Ed. Yeah. All right, Nick, the floor is yours.
Awesome. So, I mean, my path to athletic training kind of started my senior year of high school. We didn't have an athletic trainer at my high school, and I just happened to take an anatomy course my senior year of high school, and that was the first year they really offered that type of course. Nothing else in high school really stood out to me, and I fell in love with just learning the body and how things function, and it kind of just made sense to me. And initially, physical therapy was what I really wanted to get into, and looking at universities, the University of Indianapolis had a great PT program, and researching, kind of understanding I needed to get a doctorate, so I needed to go get an undergraduate degree. Athletic training was like, all right, these things look pretty similar, so let's go with this. And it just so happened that UIndy had a great AT program too. So about, I would say, halfway through my first semester of AT clinical rotations, I was like, no, this is it. This is what I want to be doing. So I did my undergraduate degree at UND. And then the plan from there was actually to get more into sports administration, because I felt that I could make a better impact on when it comes to collegiate athletics, policy making, and procedures. I felt like from the sports administration side, if I got into that side of things, I could have a better impact to help medical, patient care and medical, side of things, as opposed to becoming an athletic trainer for trade. But I actually got a great job opportunity straight out of college up at Culver Academies, which is it's a secondary school. It's a boarding school out near South Bend, Fort Wayne area. So it was a really great opportunity. So I took that opportunity, and it could not have been a better decision, because in terms of having formal mentorship within my first job opportunity, being able to grow into being a newly credentialed athletic trainer, being able to slowly kind of take off the training wheels and just learn to practice on my own, it was awesome. But in that first year, the plan was still to go back to UND. I deferred a year to go back to UND and do sports administration. Now, my mentors there really pushed me and said, you should still apply to some other master's programs, and they pointed out this Indiana State program is looking for doctorate candidates for a doctorate of athletic training. And I said, I'm 1 year grad. There's no way they're going to want me. And they said, no, you should apply. You should apply. You never know what happened. And lo and behold, I got accepted. So I went to Indiana State and did 2 years to get my doctorate in athletic training. I worked 2 years as a graduate assistant there at a high school. Very different settings compared to Culver. Culver was like top of the line in terms of structure, policy and procedure. This was like Cornfield County High School with like 20-minute EMS response time, just, no resources, just trying to have to figure everything out from the ground up. So I spent 2 years there. I think Indiana State, UND gave me a great foundation for my athletic training, experience and education. Indiana State really took it to the next level for me. So after that, I actually moved back to my hometown area here in Northwest Indiana. The past 6 months, I've been working in the concussion clinic. Tom was actually one of the athletic trainers that trained me in my job. So I did that for about 6 months, and then we had another opportunity open up with a chiropractor that the hospital hired on to be the chiropractor for community healthcare. So I've been working with him now for right around 2 months now. It's been an awesome opportunity learning from him. He's young, very up to date on best practices, what the research says. And he's pushing me to do more and learn more. So it's an awesome opportunity where I can be learning from a different type of provider, and still our practices are similar enough where there's some overlap between what we believe and how we treat things. So it's been awesome. But that's kind of my journey so far through my first 3.5, 4 years in the profession.
I appreciate you guys sharing your stories. Don't leave once I end the recording, because we're going to talk afterwards. But next week, I put a vote out yesterday for what the next topic should be, with 4 topics. And the overwhelming feedback is burnout. So I'll be contacting you next week to talk about burnout. So, yeah.
I look forward to it.
Thanks, guys.